Morning, everybody in Brazil. My name is Alexandre Marra. I'm professor of the Pós-Graduation Stricto Sensu Program in Health Sciences at Albert Einstein Instituto Israelita de Ensino e Pesquisa, and also I am a researcher at the Hospital Israelita Albert Einstein. I've been researching at the University of Iowa Internal Medicine Department in Iowa City, Iowa for 9 years. I'm thrilled to introduce our international webinar series featuring guest speakers. This is the 5th presentation of the year 2025. The International Web Series is part of our global initiative within the postgraduate program designed to connect Brazilian researchers, students, and healthcare personnel with international professors and researchers. It's my pleasure to introduce our guest speaker, Dr. Dr.AlGain. She is a consultant in pediatric infectious disease. She has received a fellowship in pediatric infectious disease from Saudi Health Commission, as well as a clinical fellowship in pediatric infectious disease from Western University in London, Canada, as well as a fellowship in infection control and geographic medicine from Stanford, California, United States. I have been honored to host Dr. AlGain here, and it's been rewarding to collaborate with her on a wide range of research projects, including antimicrobial stewardship, AI, and metagenomics studies. She'll talk to us about exploring global strategies in infectious disease, advancing research, antimicrobial stewardship, and infection control. We have planned for Dr. AlGain to speak for 30-35 minutes, after which we will have 15 to 20 minutes to answer questions. You can unmute yourself and ask questions after Dr. Suvan's talk, or you can type your question in the chat. I would like to ask for all of you to answer the survey at the end of the presentation. And thank you, and I will now hand it over to Dr. Suvan AlGain to start. Suvan, the floor is yours. Thank you very much.
Hello, everyone. Nice to meet you. Thank you, Dr. Alex, for the very warm introduction. It's actually my honor to have been working with you for the past year. So as you said, my name is Dr.AlGain. I am a pediatric infectious diseases from Saudi Arabia. I'll go a little bit back in my kind of history. So I am from Saudi. This little green dot, the one here you can see in the global in the global world map. I live in the capital Riyadh, which everyone seems to know. So this is the capital, and it's extremely busy. We have a lot of attractions. I think you guys have heard like Formula was here, hosted in Jeddah. Usually it's hosted every couple of years. And this is the track. And my grandmother actually lives just near it. So I can actually hear the drivers every once in a while when they're doing their track races. This is in Jeddah. One of the things that's most beautiful here, these air floating pods kind of things, the one in the beach. There have been a lot of attractions, and I've seen a lot of YouTube videos on it. I graduated from King Saud University. It was established around the 1950s, and this is one of the first universities here in Saudi Arabia. I did my residency in pediatrics in City, and then finally I'm working right now in a hospital called King Faisal Specialist Hospital and Research Center. So we are very, very big on research. During my fellowships, I went first to Victoria Hospital and Western London University in Canada. And then finally, my final step was in Stanford Medicine. Of course, during my travels, we had to do a lot of adventures. There was some snow coming there, a lot of adventures with my kids. My mom was there, hopefully. Thank God having my mom there helping me with my 2 little kids. There were a handful, but it was nice having 2 or 3 years traveling around all of North America. Of course, in Saudi, we are big on deserts. We have everything. So this is my son playing in the sand, and these usually do some camping there at least once a year, especially during winter season. That's nice. We do a lot of dirt bikes and, of course, 4-wheel drives. So we do have our fun in Saudi. Okay, so that's just a little bit of introduction on me and a little bit of my culture and my home. This is my baby that what I have worked on with Dr. Alex. Can we rely on artificial intelligence to guide antimicrobial therapy? This was my first systematic literature review that I have done almost on my own. I had extremely big help from Dr. Alex, and I'm working on something else with him right now. So just to conclude, AI will not take over the world right now. We still have things to do as humans, so especially as ID doctors. And that was very wonderful working on it. And I had a lot of information gained during the systematic review. There are other things, as I said, from my kind of hospital is a research center. This is another published article. It's not by me, it's by one of my colleagues, but we did work with the Casanova and other collaboration between Johns Hopkins and with Boston Children's Hospitals. This is just one of them, an approach to recurrent herpes-simplex encephalitis in children. And they I know this is in Arabic, but one of the things that I'm proud of that here in Saudi Arabia, that one of the hospitals, it's not mine, unfortunately, but we're working on it. Prince Sultan Military Hospital just gained an IDSA accreditation for antimicrobial stewardship, and that's kind of big. And I'm hoping that all my hospitals, honestly, here in Saudi can get to the same. As we're done, just a little video. I want to just show you a little bit in Saudi Arabia. As you know, after the World Cup here, a lot of international players were here. So usually a little bit of celebration. And trying to go to the next video. And of course, as mentioned with Dr. Alex before, everyone who comes in contact with us has to learn a little bit of Arabic. So your players, like Neymar, who's actually from Brazil, as everyone knows that, but we got him and his partner to speak Arabic and us. A little something, just a little taste. I don't have much more, honestly, to present more than that. It was just very quick. I just wanted to introduce myself, a little bit of my country, and how proud I am, honestly, of what we were doing here. As you know, since Between is a collaboration between works, this is something I am very happy that I did with Dr. Alex, and it is something that I'm hoping further from the future. As for infection control and stewardship, I know that tuberculosis, like one of the things, is very big between us and in South America as well. So we're always conducting studies on that. Here, it's not just my hospital, other hospitals as well, and other colleagues. And we would be more than honored and happy to actually have a collaboration between here and there. I think this is mostly what I might have to introduce right now. If you guys have any questions for me, I understand it was 30 minutes. I have just little things to talk about right now, honestly. I'm a person who prefers questions, and then I would answer.
Great, Suvan. Thank you so much. I have a lot of questions, but I'll give the opportunity for everybody in the room to type the questions in the chat, or please, if someone wish to ask questions for Dr. Suvan, please tell us that you can unmute yours. Suvan, I would like to know what inspired you to pursue a career in infectious disease and global health?
Okay, so for that, I'm a pediatrician, as I said. So and I loved every rotation I have been going through when I was in pediatrics. So I do love general pediatrics, but the career of infectious diseases has the best of both worlds, in which in one I do see every kind of clinical scenario that you might see. So I do have a little bit of immunology, a little bit of rheumatology, a little bit of everything. So that what made me actually very glad to go into infectious diseases. And at the same time, as much as it's actually broad, it's narrowed as well. And it's very interesting dealing with infectious diseases and with whatever clinical scenarios, and having a lot of cases, honestly, that sometimes people would struggle with, and they would reach out to us, and we would be able to establish a diagnosis and reach there with the treatment and everything. As for global health, I think that mostly what happened during the pandemic, like when COVID struck, and it struck everywhere, and how everything happened, the closure, the people, the stress and everything. I'm I'm really honored, honestly, to be in Saudi Arabia at that time. I handled COVID alone in one of the hospitals in pediatrics. I'm just talking about pediatrics, of course. I'm not talking about adult population. For almost 10 months, I was the first on call in anything that is related to COVID. I was happy how we handled things and everything that was electronic. Things were changed, the government as well, the accesses. I cannot go anywhere or coming anywhere or coming back and forth to anything without my electronic access there. And at that time, I see how everyone in everywhere in the world that like collaborating together, communicating together, trying to stop the spread and not just working to their own country, but knowing something that is worldwide. So these were the things, honestly, that captured my interest at that time. I think that's just like, that's what on top, but that's what's on the top of my head to have.
Yeah, and my next question is related to the COVID-19 pandemic, but I'd like to ask before the COVID-19 pandemic, because the MERS-CoV hit Saudi Arabia in 2012, 2013, and which changed in your life as a pediatrician during this time of the MERS-CoV? And what the MERS-CoV, and that's my second question, what the MERS-CoV, what was the learned lessons to, to fight against the COVID-19 pandemic?
Okay. So as you know, MERS-CoV was mostly at that time attached mostly to camel exposures. So that is something that we usually have in the Middle East. But to be honest, as a pediatrician mostly, in both pandemics, I found out that kids are very resilient. Pediatrics populations are great. And honestly, they would face any danger different than in the adults. So I don't know how much what to add to your question, to be honest. But unfortunately, what I'm seeing now is we do have a little bit of, I'm not going to say a surge, but there are some cases again of MERS, COVID here and in our country. And so we're dealing with it again, have to close it as much as we can so we don't have like a spread like last time. During MERS COVID, I was actually just like a first year resident. So I wasn't really that much aware, or let's say I haven't participated a lot in its infections or prevention or even the studies. It was mostly with the infectious diseases at that time. So I wouldn't say that I have much experience at that time.
And for now, in the COVID-19 pandemic, are you still having MERS-CoV cases, or did you know that is there any co-infection cases of MERS-CoV and SARS-CoV-2?
Not as a co-infection, but yes, we are having a couple of cases of MERS emerging again, which is very unfortunate. And it's mostly in the adult population, to be honest, rather than in pediatrics. And hopefully that this time it seems to be less aggressive than it was a couple of years back. But as a coincidence or co-infection between them, up until now, I have not seen that there was a co-infection between the both of them. But it's still emerging, so we'll see. We'll have to see what happens in the next couple of weeks, couple of months, and see where we're at.
Oh, thank you very much. And as you know, we belong to a post-graduation program in Brazil, and I'd like to know if you could share with us, were there any pivotal experiences during your training or early career that shaped your research or clinical interests? I would like you if you could share like your experience in Canada and at Stanford, California, United States too.
So as you said, this is a postgraduate program. So unfortunately, when I was a student, I wasn't that much big on research. Up until a year ago, I think there was a lot of things that I didn't understand very much during research, and I was just going through life with it. And whatever research opportunity I would get, I was just asking people around me, please just involve me. I need to be involved. I need to explore a little bit more or understand a little bit more. But to be honest, when I started in Canada and then later on Stanford, I was able to have some time for myself. So, and I understood, especially after COVID again, that research is something extremely important in this world, and we do need to be more involved in it. So that's when I started again examining this part. So I started reading a little bit more about it. I had a little bit of case reports done in Canada, but I was more big, or as I did my systematic literature review with you, this one with the AI, with the antimicrobial stewardship while I was in Stanford, I understood more how much of importance is doing research and how to actually and how differences between different types of studies. And that was all thanks to you, Dr. Alex, honestly, all the sessions that I've been having with you past year. And from there, honestly, from working with you, Dr. Alex, that's where I started to have more fondness or more awareness of the research world. And before I would do it like it was something that I just had to do, but now it's something that I want to do. And that's a big difference. That's something that wanting something is not like having to do something. And I've been working more now with University of California as well. There are other researchers in meningoencephalitis. One was just published recently and for adults, and hopefully something new on the horizon. And more research studies I've been thinking about, even here in our home. I cannot really go into it that much because it's still in these early phases, but at least going somewhere outside for me, going internationally, traveling from one country to the other, seeing the perspective of other people and the experiences of other people, it opens up a lot, honestly. That doesn't mean that I did not have the opportunities here in my hometown. Actually, it is. We are very interested in, as I said, my hospital is a research center. So we are very interested in research ever since I was in my residency and even before. But exploring other people, other cultures, other countries, and how to conduct and where to conduct and what are the aspects that the person should be working on, it gives you a different perspective. And that is something that I've gained a lot in Canada and Stanford. Hopefully that might help answer a little bit of your question.
No, yes, of course, you answer completely my question, and I appreciate your kindness. But what I'd like to know, and that's interesting because we are both international fellows. You know, you are in Saudi Arabia, we are from Brazil, and sometimes when we decided to study abroad, like you studied in Canada or United States, I know that the healthcare personnel, they can be afraid to lose their jobs, you know, or to lose present opportunities, because if you are 1 year or 2 years outside our countries, what are your perspective or what are your advice you'd like to give to early career researchers or these healthcare professionals that they intend to study abroad? If you think that there are advantages or more or less advantages than disadvantages to study uh, abroad. What is your advice? What are your thoughts about that?
Of course, it's always scary leaving your family, your friends, and everything behind you, and your environment that you're used to it. But like for me, let's say when I left here and went to Canada and America, to the US as well, I was told that maybe after I'm done, I might not have a position back home, which is sometimes expected. That's everywhere. Nothing is guaranteed for the future. But I really believed that traveling and gaining this experience would eventually give me the advantage, or gives me an advantage coming back home. I did gain a lot of knowledge and experience, as I said. And even I know deep in my heart that even if my hospital at that time was not having me back, still gaining and going everywhere, giving you something different, it would definitely gain you something. And as scary as it is, and even if you're being uncertain, still go with it, trust your guts in these kind of things, and go experience something different. Even if you do not come back to something that is stable, eventually something will open up to you. That's my motto in life. That's how I live, honestly. So yeah, I think that's what I have. It's for you, Dr. Alex. Sorry, it's not really a very professional answer. I understand that, but that's how I go with my life. Like if one door closes, another door opens. So as scary as it is, go live your life and experience it, and eventually something will happen.
Yeah, but these answers is part of the real life, and that's what we want from you, because I'm interested to know how did you get, for example, because sometimes from Brazil we get financial support from the Brazilian government. We need to apply for different grants or scholarships. And fortunately, at Albert Einstein, we have like a specific scholarship for healthcare personnel that they want to study abroad when they finish the PhD. We can apply for a postdoctoral scholarship. Do you have anything related this to Saudi Arabia? How is the pathway for someone in Saudi Arabia that wants to go to United States or Canada, or if it's different, or if you get your financial support from their specific countries? Could you share a little bit more with us?
Yeah, it's almost similar to what you have said, Dr. Alex. Usually, what happens with us, my sponsor, or who's ever giving them my financial aid, is going to be the hospital and the government. There are I can get some financial support from the Ministry of Education. And in this, it's mostly just the government is aiding me without any help from any other parties. Like when I went to London, both my hospital and the government would pay me. It's little, but it's something. It just helps you get by there. So, but the difference is, I think now is like a couple of years back, and I think that happens everywhere, to be honest. This financial ruins and financial aids is different from one place to the other. That before, when one of the hospitals here would send you, it's guaranteed that you will come back and work for that hospital. But this is different now. It's not the same. They would help you gain a scholarship, as it is very beneficial for you and for your career to it would highlight your CV, and it's everywhere. When you go and do whatever studies, or you're looking for guidelines or procedures or policies, you usually go to North American guidelines. So it is a very big advocate for us to go and gain the experience and knowledge in North America, including US and for both US and Canada as well. So even as I said, even that if the hospital is not completely supporting us, we still have other ways from the government, as the government is trying to nourish our kingdom as much as we can. So yeah, they do have some stipends, a little bit left on the side for students such as me or my colleagues as well, to help them advance and go gain their scholarships wherever, worldwide, and gain whatever knowledge there just to bring it back home. So it's almost the same as, yeah, the Brazilian awesome colleges as well. I think we have almost the same alignment in how the government or hospitals are helping students for scholarships.
No, thank you. Yes, but I'd like to know specifically, like, it's like, how can I say, a national competition. There are many, physicians, nurses, pharmacists requesting these scholarships. Uh, there is a limited, spots
Yes, limited.
for. Is there are
Yeah,
limited spots?
we do have limited season spots, yes. And that usually can, like with the hospital itself, it's the department's part to actually fight for these spots. Like sometimes the spot could be for rheumatology or for other institutions or other specialties. But if, like in my case, they wanted a pediatric, so they had to fight a spot from another department to take it, at least for this year. That I have a candidate that is ready to travel. And by next year, hopefully a new spot will be open and the other department can have it. So yes, there are some, it's not a lot of spots, that is for sure. And there are some, I'm not gonna say fighting for the spot, but yeah, departments have to gain or see how they can take that spot before another department does that. And we usually have it as well with the Ministry of Health and the Ministry of Education. I'm not going to say first come, first serve, but what we do is, like, if I am being spotted from the Ministry of Education rather than a hospital, for the Ministry of Education to sponsor me, I would have to first get it, an acceptance from somewhere else. So that would give me the lead in comparison to one of my colleagues who's still just applying for the Ministry of Education for the funding, and then applying for the acceptance for a college. So in this, between me and him, I would have the advantage, the upper hand, as I had an acceptance from somewhere in North America or any other respectable colleges or universities.
Oh, great. Thank you. I have a lot of questions for you, but I want to open for other people in the room. Please, if you have questions for Dr. Suvan, type in the chat, or tell me that we can unmute your phone. Any questions for Dr. Suvan? Suvan, and I'm really interested to know, have you had mentors? What is the influence of your mentors for shape your research and what you are doing right now of leadership in infection control?
Sorry, again, can you repeat that?
I want to know if you have mentors that influence your research and what you are doing in terms of leadership in infection control.
Yes, yes, I did during back my fellowship from here, and as well when I traveled. As I said before, when I was a student and resident, I wasn't really that much keen into research, and having some people who are a little bit older than me, more experienced, into going into a research, and they're the ones who actually taught me how important it is. And I do have a couple of people that are really pushing me up until now. They're still pushing me to go more and more. And one of them was actually Dr. Sahibani, who introduced me to you and Dr. Jorge. And that was very beautiful. And I really appreciate what he did. And this is pushing me again to have more collaborations and more work to go on. I'm not sure if this answers your question, but yeah, a lot of people who are more senior to me have pushed me to that direction, even when I did not want to be in that part of the world in the healthcare or medicine. But yeah, they shaped me into it, and they made me love it and understand how important it is and what to do and what not to do. And I'm still a work in progress. So I'm still
Oh,
getting there.
great. Yes, I like to know a, a lot of details of our guest speakers' life because I know that, for example, one of our friends from Saudi Arabia, uh, Dr. Abdullah, he had a mission to come to Iowa to learn infection control, to open a CDC in Middle East because of MERS-CoV. And it is very interesting because this was in 2016, and 2020 we had everybody was hit by the COVID-19 pandemic. And I'd like to know what is the decision of, for example, Abdullah was designed to come to Iowa because of specific mission. In your case, someone from your hospital told you, Suba, you need to do this because of the pediatric infectious disease, or this is your own decision, like you had some mentor that inspired you, like Muhammad Suhaibani, to go to Stanford? How can we connect the dots to understand, different stories considering research decisions?
Okay, so I think it's a little bit of both, to be honest. Like for me as a pediatrician, again, pediatrics ID, I don't have, let's say, I don't have a lot of opportunities as a subspecialties in comparison to adults, but still being hit with the pandemic at the time, a couple of my mentors already went to have some infection control. That opened up the idea to me and warmed me into it. Going through it during the pandemic was one of the things that I have to learn how to stop the spread, how to talk to people, how is it really stressful. It's more than one aspect. Usually things like infection control, just like, okay, you know how to understand the precautions and that would be it. But when you go into it, you know that it's a whole new world and it's something different and there's always something new coming from there. One of the things, as you said, from the hospital, let me say that I know, or we know, that I do have a lot of people who are leaving their seats. So we would need like an infection control representative coming instead of this person in a couple of years. So this was one of the things that pushed me into it. But at the same time, working with other people who are very passionate about it made me more passionate and understand the actual importance of going into this subspecialty. So I might not have, if you had spoken to me like a couple of years back, I might not have chosen infection control as a subspecialty. But after the pandemic and after working with a lot of people, then yes, things would have changed. And it is a very great perspective. And I'm happy. I'm happy that I actually went into it. And I'm still learning. I'm still gaining a lot of information. And that's good. Working with nurse practitioners when I was in Stanford, having to go in real life. It was a very, very beautiful experience. And I'm still living in that experience as well.
Yeah, I totally agree with you. I think that because of the COVID-19 pandemic, we know that there are a lot of tragedies, a chaotic time, but aftermath, what you are seeing is a lot of connections. Like we are working together every week. We have like Zoom meetings to discuss our research projects. The perspective is to amplify the infection control prevention. For example, I'm adult infectious disease, you're a ped infectious disease, but the perspective to learn or to have ideas of research projects for pediatric infection control and infection prevention, because in many times we are thinking about the adults and try to transform things from the adult scenarios to the ped scenarios, and
Yes.
it is not fair, no. And that's why I appreciate with you and Mohammed you are doing in your institution, and you are collecting data to share knowledge for everybody. I'd like. Oh,
Yeah, and that's one of the biggest. Oh, sorry, I'm talking over you. But that point exactly is one of the biggest things that pushes me more to going into research. I feel a little bit envious of the adult world. It's not really fair to my little kiddos. So everything happens in revolutionary medicine is in adults, but not so much in pediatrics. We just take what you guys apply on adults and try to apply it on our little kiddos. And that is something I'm hoping that can change in the next couple of years and have things advanced for peds population earlier even. So yeah.
yeah, and I appreciate that, and I think that we can collaborate more with the pediatricians, and
Yeah.
that's why we invited you, because we have a wonderful pediatricians at Albert Einstein, and I would like to have this opportunity to integrate you with these guys for future research projects if you are available.
Yes, I would love that, honestly. Yes.
Suvan, and regarding your ASH paper about the AI to guide or not antimicrobial prescriptions, I'd like to know, how do you see these emerging technologies, such as artificial intelligence? And I know that you are working now with metagenomics for the diagnosis of infectious disease in pediatric population. How do you think these new tools they can reshape the infectious disease, like
So,
surveillance or infection prevention or antimicrobial stewardship?
right. I think having something new is always scary at start, but these technologies, I feel they're very beautiful to add. They are very easily accessible, and it's nice getting in touch with them and just trying to see, as you said, one of the things is surveillance. So that is something big in infection control, in geographic medicine whatsoever. And using the surveillance and metagenomic sequences and implementing it in artificial intelligence or asking questions for artificial intelligence will help guide you on how, where, and what to do. And these are things that you need always to go through. So yeah, in ID and use the artificial intelligence with AI, I feel it helps the population as well, people who are not in healthcare. And these becoming more and more accessible, asking questions like, oh, I have these kind of symptoms. What is my diagnosis? It's different than when you used to ask Google before. Dr. Google was different. With AI, it's actually becoming a little bit more accurate than before. And that's helpful, especially with, again, with the population around us, makes it more aware that not everything requires antibiotics. I know a lot of people would actually, as soon as they have a fever or a cough, they're like, please prescribe me antibiotics, it's going to make you better. But getting the use of these tools would help the population more aware and help us as well. And when I was going through my systematic review, I found that there was a lot of tools that can help us in whether in diagnosis and trying to help a little bit in prescribing medicines. I like using, honestly, a lot of AI tools to help me calculate the areas under the curves for a lot of medications. And this would help me or direct me on narrowing my antibiotic choice while I'm trying to treat a patient in a lot of clinical scenarios and cases. So I think it's an experience and something still going on, but it's helpful. It's helpful a lot. And it's been helping me a lot in the past year.
And regarding in your systematic literature review, can you deep a little bit more talking the difference that you found related to the clinical decision support system integrated with electronic health records, and the difference that you found considering the large language models like the ChatGPT, if you can trust or not in these large language models to guide us to prescribe antimicrobial.
Yeah, okay, so decision support then followed with the large language models. I found honestly when I was going through a lot of the studies, artificial intelligence in all of its kinds was very helpful a lot in diagnosis rather than providing a specific treatment or an accurate treatment. Um, in electronic health records and clinical decision support systems, the value of it or the advantages that's there, most of it are machines that have been implemented with information that is from actual physicians. So that would help them guide the diagnosis and then further on to reach the appropriate treatment. But in large language models, I think it's scarce in the ones that are integrated with physicians' decisions or diagnoses or how or decision trees that they actually go into it. And therefore it would just roam around the internet, finding the whatever treatment or solution that he seemed to have appropriate. And when I was going through it, honestly, there were some answers from personal Facebooks and personal Twitters or these kind of different websites. So it was not really accurate or appropriate, and it would give just different decisions, but whatever just posted in the web. So yeah, it's not that safe. Still, we're still going there, but that's mostly what I got from my paper. So in the prescription part, at least.
And in your institution, are you using artificial intelligence to help or to support physicians to prescribe antimicrobials?
No,
Not
no.
yet.
Yeah, no. They started to implement new artificial intelligence like just ChatGPT, but with the dietitian for cancer patients. This was one thing. It's mostly for the families to see. So you can ask directly with the AI. Can I give my kid this? Can I give my kid that? What is the downsides of these kind of medicines or food or whatever snacks? And a little breakdown would come. So this is what we just started, and I'm hoping, yeah, a little bit sooner, a little bit in the future, more and more of use of AI in actual clinical practices would help.
And uh, about the clinical decision support system, do you have any
We do,
examples that you can
yeah.
share with us?
Yes, but unfortunately, as I said, again, I'm envious of the adult world. It's mostly in the adult, and even in my hospital, it's still in the adult population rather than in pediatrics. So they do have like clinical pathways the system itself. Like when a patient comes with viral neutropenia, it would guide you in how to go and what to do. It's like a decision tree, and it's very beautiful. It's very accessible and easy, and it's whenever it's impregnated or collaborated with the chart itself. So whenever the patient spikes a new fever, it will tell you what's the next step to do. You're supposed to do this, or you're supposed to do that, until finally, oh, you're supposed to reach out to infectious diseases clinical support to further help in this situation. They do have a different, not just for neutropenia, they have clinical pathways for CMV as well in transplant. And these are things that we go usually with international guidelines, but having it implemented in the system, as I said, as a decision tree to go what is the next step, this is something very favorable and makes it easy and makes it honestly between teams to be all on the same side. Okay, we understand now we're at this step. This is what we're supposed to do next, and this is what we're supposed to do next, instead of just having this different expert opinions as what happens in many institutes. So yeah, we do have a little bit, and now it's not me. We're bringing my department is trying to bring more in pediatrics as well. So we're going to have our own also clinical decision support systems.
No, great. Yes, we are advancing in our time. I have a last question for you, but to wrap up, I'd like final considerations. My last question is, after your experience studying abroad in Canada and in United States, how was your life after that? I'm Italian about, I see by the pictures that it was really nice to see your kids and your mother, United States. But what do you think that happened to your personal life? Oh, now I'm better person than before. And about your academic life in your institution, if you get any promotion, what you are doing different that you're getting all these experiences to apply in Riyadh, Saudi Arabia.
And so uprooting my family was a little bit difficult to start, but honestly, going there with my kids, you get to know your kids a little bit more. And I found out my son was extremely independent at the age of 5. He would do everything around the house, which is kind of nice and scary a little bit. Sometimes, even if I'm asleep, he would actually go and try to cook something for himself, which is extremely dangerous. But this is something to know that he's a very independent person. Scary as it was kind of funny as well, having to experience it. As for advancing my career, hopefully, yes, getting to know more people. That's one of the things that I've gained a lot from going abroad, meeting new physicians, new people, having to meet. It's not just physicians, honestly, even meeting my neighbors there, having the going to abroad schools and see the other parents, talking to them, conversing with them, knowing how every country goes through things, and it was kind of beautiful. So it's a new experience. So yeah, I think I'm hoping it made me the person that I am today, and even a better person in the future. It was nice going through it in the past 2 to 3 years, but to be honest, coming back home is much it's a lot better.
And
Yeah.
about your jobs, about your promotions, what
Mhm.
happened?
I'm still going there. I'm still going through them. So yeah, it's still there. It takes a while, but yeah, I'm a consultant now, so that's nice. And this going abroad helped me get into this position. So
Great, wonderful. And usually we ask for the guest speakers to wrap up the session. Final thoughts.
hmm. See, now you just got me stuck there. I don't know what else I can
Yes,
add.
you can cover like giving advices for studying out abroad or about the research. What do you want to advise us from
Okay,
Brazil?
so my advice to you is that even if something seems or looks that it might not cause that much difference, or what's there would be no use and for you at least as a person in going through a certain field. I believe that every opportunity is given to you, it's something that you can gain. And whether if it's a bad experience, a good experience, life is full of experiences. You do have to collect them all and just be a better version of yourself. And know that, again, every opportunity that is landed in front of you is an opportunity to be gained. And you will learn something from it, whether at that time you did not see it. But yeah, I think that's mostly it.
Great. Thank you very much, Suvan. It was a lovely talk today, and I hope that we're still collaborating in research projects
Yes,
from
I
Iowa
hope,
or
yeah.
Albert Einstein, because now it's easy, to be connected. Thank you very
Yes,
much.
yeah, that's one of the, I think, things good about the COVID is it's easily connecting with everyone everywhere.
Yeah,
Thank you so much for having me. And I hope that you guys benefited even a little from my talk. Thank
of
you
course.
again. And
Absolutely.
thank you, Dr. Alex. Thank you.
Thank you very much, and thank you very much for all the attendees of this session. Bye
Thank
bye.
you.
Take care, Suvan. Take care,
Thank you.
everybody.